Today we are going to show you how your nervous system controls and coordinates every cell, tissue, and organ in your body, and how chiropractic care can help you achieve and maintain your maximum health potential. If you think of the brain as a central computer that controls and coordinates all the functions of your body, then the nervous system is like a communications network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through the spinal column. Along the way, smaller nerves branch off from the cord and pass out from the spine between each of the movable vertebrae. These branches divide again and again into tiny nerve fibers and fuel the entire body, going to each cell, organ, and tissue. Every human has an estimated 15 billion nerve cells sending and receiving messages through the spinal cord. That being said, our nervous system is extremely sensitive. So what protects it? Well, you're right, the spine. Your nervous system is the only thing encompassed inside of bone for a reason, because it's the master control system, the original system. This is what a normal, healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the sensitive nerve tissue and allows us to bend, flex, twist, and move without compromising the nerves. If the spine is not moving correctly, it's referred to as a vertebral subluxation complex, or for short, a subluxation, often referred to as a shift in the spine or misalignment. Researchers at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small dime. Compression can exist without pain. So that means where the nerve goes, we could have 60% of the nerve supply cut off, and you might not even feel it. This is what is referred to as a silent subluxation. Even slight pressure on the nerves can alter the quality or quantity of the messages being sent. It can slow it down, it can speed it up, or it can distort the nerve messages to and from the brain. At the tissue and cellular level, the interrupted nerve can cause damage to the tissues involved. The purpose of those bones or vertebrae is to protect and house the master system, the original system. So when your spine is in the right position, your body will actually heal and function at 100%. Your brain sits on top of the spine, and your brain is firing messages through the main wire, called the spinal cord. It's just like any other wire. Subluxations can interfere with normal communication between the brain and the body. So, for example, the nerve supply from your neck goes to the immune system, pituitary glands, sinuses, face, middle and inner ear, eyes, tonsils, teeth, neck, and shoulder muscles. The nerves from your thoracic spine go to your arms, hands, and fingers, heart, lungs, gallbladder, liver, stomach, pancreas, spleen, kidneys, small intestine, and lymph glands. From your lower back, the nerves go to the large intestine, appendix, abdomen, sex organs, uterus, prostate, bladder, knees, lower back, and leg muscles. And that's just naming a few. Okay, so now that you know where they go, what does that mean? Well, that's a good question. If the nerve supply to anywhere in your body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again. If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles in the arms and hands. In the thoracic spine, it can lead to asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, and even chronic tiredness. In the lower back, it can lead to constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness in the legs, and cramping, and I'm just naming a few. Now, you might be wondering what causes subluxation to occur. Well, it could be a lot of things: gardening, sports, computer work, pregnancy, birth, improper lifting, arguments, food additives, chemicals, poor posture, and carrying extra weight can cause subluxations, just to name a few. They can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many little last incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction, or excessive force, 95% of the children had upper neck injuries. So it's a smart decision to have your child assessed at an early age. The chiropractor's job is to locate and correct spinal interference so that your nervous system can perform at its own optimal level. In your evaluation, we will or already have evaluated 3 key components to your healing process. We evaluated the health of the spine, which protects your nervous system, and your neurological health, and lastly, your metabolic health. You might think, well, what does my metabolic health have to do with my spine and nervous system healing? When looking at metabolic health, we look at 2 things. 1, the amount of stress on your weight-bearing joints, like your spine, knees, and hips. Did you know that every pound we carry above a normal body mass index is equivalent to 4 extra pounds on the weight-bearing joints? So if you have 10 extra pounds, that would be 40 pounds of stress on your joints. 20 pounds extra would be 80 pounds of stress on your joints. Extra weight is an accelerating factor that speeds up the degenerative process in your spine and joints. 2, we will also evaluate your metabolic score to make sure that your metabolic health is not working against your healing process. When we experience symptoms like food sensitivities, memory loss, brain fog, anxiety, depression, digestive issues, allergies, thyroid disorders, autoimmunity, inability to lose weight, and even joint pain, many of the times it's the body experiencing the breakdown of the digestive tract, allowing foreign invaders to enter the bloodstream, and in turn breaking down the immune system, causing it to react with symptoms and decreasing the body's ability to heal. Your practitioner will address all of these components in your evaluation. Remember, an immobilized area will degenerate at a faster rate than the area with good balance and movement. The degenerative area will have a decreased nerve supply to the respective organs on the end of that nerve. Fortunately, with the right care and by mobilizing these areas and creating good alignment, the body can begin to slow, stabilize, or even reverse the degenerative process. Chiropractors accelerate the healing process by reestablishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Chiropractic does not treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Well, your body does. So, sit back, relax, and your chiropractor will be with you shortly to discuss your unique case and the future of your health.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.